We'll get started in just a couple of minutes here. Welcome. Hi, everyone. Welcome. We'll get started here in just a few minutes. If you haven't attended office hours today, we often use the chat. So you'll see some good links in there throughout the day today. My name is Abigail Fisher. I use she, they pronouns. I will be your host today. Joined alongside me is Justin Mann. I have to drop off at 1:15 today, so Justin will be taking you through the rest of the presentation after I leave. You are in good hands. All right, everyone. Well, we'll go ahead and get started here. It'll be a short office hours today. We will have plenty of time for community questions, which is a good thing, but don't have a ton of content for everybody. But we do have a few announcements that we want to share up at the top. So we can go to the agenda slide. So we have a couple of updates across 3 of our technology products: Client Care Search, Central Registry, and OwnPath. Once we finish those updates, we'll move on to our community discussion session. So please put your Q&As either in the chat or the Q&A function, if you want to be more anonymous. And we'll usually spend the second half of the time answering questions as needed, and then ending a little early if folks don't have any questions for us. One thing that I did want to say up at the top is that we have a new email newsletter software. It's called Gov Delivery, and today's follow-up email with the content that we discuss in this session will be the first email that we send to you via that new Gov Delivery newsletter platform. So we're using MailChimp previously, now we're using Gov Delivery. So if the email looks a little bit different, that'll be why. So I just wanted to mention that at the top. All right, so we can jump in with some technology updates. And the first 2 are mine. So we have a new product at the BHA called the Client Care Search. Some of y'all on the call, if you are inpatient or residential providers, probably know about this already. So this is a tool that is a legislatively mandated tool where inpatient and residential behavioral health providers that are licensed and designated by the BHA are tracking their bed availability every 24 hours. And then that data is being surfaced to a directory so that care navigators around the state, from state agency staff to care navigators within behavioral health provider organizations, can use that information to find appropriate client placements. Right now, we're doing a rolling onboarding of this platform. So from June 17th until August 1st, we're getting all of those inpatient and residential providers into the system, updating their bed availability and practicing to make sure that we get to good data accuracy. And then after that August 1st date is when we're going to start to extend invitations to other care navigation staff, starting with state agency staff, and then moving outwards from there. We're also excited to announce, and this we'll also talk about this in the central registry, where we'll be releasing a feature in the next month or so that will allow provider organizations to assign user admins, and those user admins will then be able to add and remove users from the platform, as well as conduct their own trainings on the technology platform. And this has come after a lot of feedback from providers that sort of scheduling one-on-one trainings is just not efficient or scalable. And we know y'all are busy, so we're really excited about that new feature. A couple of key resources here. These are all linked to when I send out the slide deck, these will be linked to, but they're also already available today on the BHA for Provider page. And after I finish my content, I'll make sure to drop that in the chat, or if someone's listening, they can drop that in for me. And then finally, just if you ever need help desk or training or any sort of information about the client care search product, we have that CDHS underscore BHA underscore provider underscore support at state.co.us. That email is monitored 8 a.m. to 5 p.m. Monday through Friday for all BHA technology platforms. It helps us if you put the name of the technology in the subject line, but we'll be able to figure out what you're talking about no matter what. So those are my updates on client care search. I'll pause for any questions there. Thanks, Justin. All right. And why folks are maybe thinking about questions that they want to surface now or via the community discussion time, I'll start to share some similar aspects around Central Registry. So Central Registry is another BHA platform that we maintain. This platform is for opioid treatment programs. So opioid treatment programs to check in and discharge clients to ensure that we're not having clients that are double dosing across OTPs in the state. So this tool will also get that new user admin feature in the next month or so. So we're really excited about that. And are in the process of updating our training materials again, so that y'all have videos or and are able to train up your own staff on those technologies. So in case you need a refresher on any training materials for the Central Registry, those are also on that same BHA for provider page. And it's the same email to get tech support. So just wanted to reshare that information in case people needed that. And with that, unless there's any questions and folks are free to put questions in chat or that Q&A function, I'm actually going to turn it over to Jumana, who's going to talk to us about OwnPath.
Thanks, Abigail. Hi, everyone. I'm Jumana. I wanted to give you all a few updates about OwnPath. So for those of you who may not be familiar, OwnPath is a public website that is managed by the BHA. It's essentially a provider directory of behavioral health providers across Colorado for those people across the state who are seeking mental health or substance use care, either for themselves or their loved ones. Wanted to give you all a few updates regarding this. So something new and exciting is that we're going to be adding a new filter to the website to allow users, those people seeking care, to filter by DUI classes and services. This is something that's been requested and was previously part of the ladders directory. And so we want to make sure that this is available on OwnPath as well. And then the other thing is we're working on adding non-BHA regulated or non-BHA licensed providers onto OwnPath as well in order to expand that provider list that we have on there. And something else that we have mentioned previously, but is also coming up, I wanted to send a reminder, is we're developing a tool to allow providers like yourselves to update your information that will be available on OwnPath. So it's a way for you all to have autonomy over that data. And we'll be coming up with more updates about this in the coming weeks and months. So for any questions or feedbacks that you have about OwnPath, we have an email that we encourage you all to reach out to us with. It's CDHS underscore BHA underscore OwnPath underscore team at state.co.us. And like the Central Registry email, this is monitored 8 a.m. to 5 a.m. Monday through Friday. So we encourage any feedback or questions that you have about the site. I think Justin, you linked the OwnPath in there, but I'll also send out the email in the chat as well.
All right. And with that, we'll cruise right into community discussion. So normally we have about like 30 minutes of content and 30 minutes of Q&A. We have a little bit less this month just because we're a little light on updates, which is okay because it gives us more time for Q&A. So any and all questions we're open to in the chat or the Q&A function if you prefer to be anonymous. If we can't answer them, we'll make sure to follow up if you provide your email. So yeah, we want to turn it over to y'all and see if you have any questions on any of the technology systems we went over today, or any of the other technology systems that BHA manages. Yeah, Andrew, go for it.
Um, so, um, Thanks for all this excellent work on the client care search and the registry and OwnPath. We're excited that non-BHA clinics are going to be represented in OwnPath. I think that's really going to help. Um, my question has to do with the one source of truth concept and how the OwnPath directory is going to overlap content wise with the 211 directory, which sounds like the Office of Electronic Health Innovation is prioritizing the 211 directory. So I'm wondering if we make changes in OwnPath, we got to go and make changes in the 211 and vice versa. If y'all have any plans regarding that complication, or yeah, if you have any thoughts about that.
Yeah, thank you for that question. So something that's important to us is making sure that you all definitely don't do that, and so that you have one place to update your information. So we're working and collaborating with the Office of Health Innovation to make sure that that burden is reduced on you all. At this time, both of the product is still in the early stages, so we're still in the planning of that, but of course, that's something that is definitely one of our top priorities for it.
And I'll surface this one from the chat from Kevin. Will OwnPath ever show bed availability pulled from client care search? So Kevin, this is actually a research question that we were able to unpack, and those research reports are available on that BHA for provider page. You would want to go check out that bed capacity tracking research report. And what we heard from providers and from other stakeholders around the state is that there was some fear that elevating that bed availability number would encourage folks seeking care for themselves to kind of show up at those locations, even if that care wasn't necessarily appropriate for them. So the plan as today is to not surface that data because of those concerns, though I think that as we continue to grow our maturity of our technology products, we will have more flexibility to be able to turn off and on the different data that we have depending on the needs of our community. Any questions, any further questions about that, Kevin? Cool. Awesome. All right. And I'm going to hand it over to Justin now to be the MC because I have to jump. So thank you, everyone. And if there's any questions about client care search, they'll likely be routed to me via email and I'll help you out there. So bye, everyone.
Thank you, Abigail. Does anyone else have other questions? And pretty much anything is on the table within reason.
Justin, looks like there's a question in the chat that says, is the intention down the road to add availability for outpatient counseling? I'm assuming this is not related to OwnPath.
Andrew, are you specifically asking about the ability to look up and schedule an appointment type of availability, or were you looking for something else? And feel free to unmute to go deeper.
Thanks, Justin. So there's levels here. What we're implementing is a limited view of availability. That's essentially number of teens, number of kids, number of couples, and number of adults that a clinic has availability for. And we have data sharing agreements with about 22 clinics to update that information weekly so that we're more likely to get clients into care quicker. And just, what you're suggesting here, scheduling data is actually a little bit more granular and a little tougher. So I
Much.
think we don't want to get that close to it, but we do want to give people a sense of, whether a clinic is really actively taking Medicaid clients, because the provider directory lists are inaccurate in terms of availability, and OwnPath would be an appropriate place to put that.
So it sounds like you're talking about essentially what is capacity for outpatient consulting. In a similar way, what is capacity for inpatient beds? Um, I don't want to speak for Abigail there, but I will make sure that that is answered in the um, the report out at the end of this that she sends out by email. We try to answer all the questions within 48 hours, so I'll make sure that that's in there. I believe that the answer will be that is something that we would like to look into. The question is simply where in the roadmap. The goal is to make sure that the right people, that anyone can find the right care as quickly as possible in the state of Colorado. So anything that we can do in that direction is something that is up for consideration. It's just a matter of time, energy, and the heat death of the universe. Sorry, I for those who haven't met me, I am a sarcastic human being. My apologies. Andrew, did that answer your question? Otherwise, look for more in the response to this, or Abigail will reach out directly to you.
Yeah, I mean, I think ultimately, if the OHI is going to support this data lake and have 211 data and OwnPath data in the same place, and there's interoperability there, we would be able to put our availability data directly into that database without going through a lot. And we have most of that already implemented. So we'll just keep an eye on the OHI and how we can get our data, the availability data, and that could take some of the work off of BHA and put it onto the clinic.
Yep, we work very closely with Ohio on this. So anywhere that we can, we will make sure that we're reducing that burden on providers. That's a core value of ours. I love the questions that are coming in. From chat, Mona, will there be the possibility down the road for supervisors to be able to access OwnPath to determine where their staff are regarding completing trainings? I am going to, unless Jemana, I am going to punt that to Abigail, because I believe she is the one who knows most about that. Mona, Abigail will follow up with you one-on-one, and the answer will go into the report out from this call. Is that fair? I just don't want to tell you the wrong thing.
No, I appreciate that. And I work for the ASO in Region 4. So we've brought this to the BHA's attention. I know that there were some hiccups that kind of precluded initially out of the gate supervisors having access, but I believe there might have been some possibilities of some workarounds being explored. So I just wanted to get an update.
Sure, and I'm realizing now that that's probably going to be a more related to our LMS team. So I will loop in both Abigail and David Sin on that one, and expect to reach out from us soon. If you can drop your email in the chat or message it directly to me or Jemana, we can reach out directly to you.
Perfect. Thank you.
Of course. Elizabeth, I agree with you. So Elizabeth mentioned it would be incredible if outpatient providers could add their own info and availability in OwnPath. The ability for providers to update their information is on the roadmap. Jemana, do you want to talk any more about that, or do you want to wait until we have more to talk about?
Yeah, I can give a quick update. So, in terms of updating their information, providers updating their information, this is a tool that, like I said, we're developing. It'll allow you to update all information on your facility. And so things like generally like what is available on OwnPath right now, as well as some other fields, just to make it easier for people who are searching for care to be able to filter better and find a provider that better meets their needs. So we think that this is really useful for you on the provider end to be able to, first of all, like have clients find you better, as well as making sure that your information is up to date as well. So happy to keep giving updates on this as we get closer to it. But if there's any specific questions you have, feel free to email us.
Andrew, thank you for putting that link in the chat. For those who don't know, you can submit a request to get access to the Jemana, which form is this that Andrew has linked? Submit your information to request inclusion in OwnPath. So if you are not currently a licensed and designated provider in the state that has information in ladders, you can submit your information to that form for consideration and inclusion in OwnPath if you want to get ahead of the curve. If you have any questions, reach out to Jemana. Did I say that right, Jemana?
Correct.
Cool. Kevin, Everyray makes providers update their directory entries quarterly, and one of those questions is whether they are accepting new patients. It would be nice if all the systems talk to one another, so we didn't have to answer that question across many different platforms. Jemana, do you want to talk to that one?
Yeah, like we spoke about earlier, again, this is something we know is a struggle, and we want to make sure that it's streamlined as much as we can. So on the back end, what we're going to be doing is working with the different agencies to make sure that this for you is streamlined. But since we're, like I said, still in the planning phases for these, so if they're like input like this is really helpful for us, because it'll help us understand which different systems you're using and where you're inputting that information, and it'll allow us to plan better to make sure we're incorporating all of those different use cases. So regarding the raise, this is really important as well. So appreciate this note.
And just so everyone is aware, one of our primary drivers here at the BHA is to reduce the administrative burden on top of all of you. So our goal is to reduce the number of places you have to update information, not increase them. So please, we're always open. We always want to know places where we might not have insight, and so that we can reduce those additional steps. But please know that these are things that are always on our mind when we're thinking about product development here. Jennifer, how do providers update agency contact information in the OwnPath directory? Right now, actually, Jemana, can you do you want to talk to that one?
Yeah, so currently what we do is we get information from the ladder system. So any information that you input there is going to be updated in the OwnPath directory. We're in the stage right now, because of some of the BHA changes, we're making sure that OwnPath is aligned with all of the new updates in ladders. But if you have any updates that you need to make, those will be in the ladder system, and then we will get them on OwnPath. But if you have any issues related to that, the best way to contact us or any questions is through that email.
Thank you.
We did get one question through Q&A. Can you sort OwnPath by youth services to find specifically youth residential and outpatient programs? Just in case anyone has not seen OwnPath yet, this you can search by age for under 18, 18 to 64, and 65 plus, and the type of help that you need, and then I believe that there are a few other filters that you have added recently, but yeah, hopefully that answers your question, whoever asked that. I would encourage you to go to ownpath.co and play around a little bit. so that you can find out more. Or Jemana, do you want to add anything?
Yeah, I'll just add one thing. So this type of help filter that we have here, what we're one of the features we're working on next is to make that a little bit more granular, so you can search for more detailed uh, uh, details about different facilities. So whether something is like residential or outpatient, that type of stuff. So we're working on more granular filtering as well.
Hopefully that answered your question. From Andrew, BHE essential safety net rules require reporting on referrals to care coordination, social determinants of health, community-based organizations. When we refer clients to the RAIs for care coordination, we need to report if the RAI did something. Will BHA require RAIs to report that data somewhere, either to the BHA or us or both, so we can close the loop? Andrew, excellent question that I do not know the answer to. I will go and chase that down, and we will send out an answer on that one. Any other questions? I see more coming into the Q&A function. Jemana, does OwnPath allow to sort by residential or outpatient, or just providers who serve youth?
Currently, the filter is for youth, but the feature that is coming up next is more granular filtering regarding the facilities like residential and outpatient. So we'll once that feature is released, we'll give another update here as well in this office hours.
All right. Any more questions? All right, I have waited a sufficiently awkward amount of time. So we have no additional content for you. If you would like to hang out, we will stay for a little bit until everyone has left the meeting. So if you do have additional questions that you'd like to talk to us in a smaller group setting, please feel free to hang out. Otherwise, if you have other things you would like to be doing with this time, please feel free to drop off at this point. The recording will be available. Notes will be sent out later. And so if anything does come up, you can always catch up later. Thank you all for your time today. We appreciate your ability, your willingness to come in and chat with us. And we hope that these are helpful. If you have any feedback, please feel free to reach out to anyone at the BHA or to the help desk. And we would love to get feedback on how we can continue to improve our interaction with you, so you know what's coming up and you are included in all of our work. Because at the end of the day, we are largely here to make your lives better. So thank you all for your time. Folks from the BHA will hang out for a little bit longer, but otherwise we will see you next month. Michelle, Leanne, Graham, do any of you folks have questions, or have you simply stepped away from the computer and are no longer here? At this point, I'm going to stop the recording. Thank you all. If you are watching this later, please reach out if you have any questions.